I'm with Battalion Chief Stephanie Ramsey this morning. And Stephanie, thank you for taking the time to spend a few minutes to talk about what it's like with the Fire and Rescue Department right now in the city of Norfolk. Could you do me a favor and
Sure.
tell us a little bit more about fire and rescue and what that encompasses and what your role is with the fire department?
Absolutely. Well, first of all, thank you for having me, Andrea. And second of all, I'm really grateful for the opportunity to kind of give a little bit of our perspective because I think that we are, especially now, so kind of sheltered in our own little circles that we don't often get the opportunity to kind of spread some information and hopefully even positivity about all of these issues that we're experiencing today. The unique quality about Norfolk Fire Rescue is that we have since 1991 been joint fire and EMS, which means every single one of our employees is cross-trained with fire and EMS. So when we respond, oftentimes you get a fire truck and an ambulance, and that's because everyone is trained to do both, whether it's medical or fire calls. And that's one of the things that makes us such a great quality about Norfolk Fire Rescue, because we, within 4 to 7 minutes, will have the highest trained pre-hospital care provider on scene. And it's really reassuring because whether it's an engine truck, or a ladder truck, or a rescue company, or even a battalion chief, everyone is cross-trained. And that's one of the things that I think makes Norfolk Fire Rescue unique and more qualified even to do whatever job we are asked to do.
Well, and as we anticipate a surge in the Hampton Roads area and in Norfolk, I imagine you guys are going to be on the front lines for sure. Answering the 911 calls, folks who need help. Can you give us a sense of what you're seeing right now and what you're anticipating?
Absolutely. So thankfully, our call volume has actually gone down just a bit. And I think that whether it's people are heeding the advice of everyone that is giving it to stay at home, really evaluate whether or not a trip to the hospital is necessary, or if people are just being extra cautious. I don't know, or maybe it's a combination of everything, but I think that what we're experiencing, which has given us a lot of opportunity to really feel like we're more prepared, I think we're seeing a little bit of a lull and kind of just more of a waiting game to see when or if a surge actually happens, which will make us more prepared if it does. I think that, we're still answering any type of call, but I think that the community is really trying to make an effort as well to continue to kind of evaluate whether or not 911 is absolutely necessary. And so for whatever advice has been given, I think that they're actually listening, and it's encouraging. So gives us the opportunity to be more prepared. Our logistics division has been working tirelessly, even from the very beginning, before the beginning of all of this, to ensure that we have all the proper PPE. So we're prepared when and if this surge ever hits.
That's great. Well, I mean, I know that we are so grateful for all that you all do, for putting your lives on the line to save us on a daily basis. How many are in Norfolk Fire and Rescue? How many folks?
We have just over 500 for our total staff.
Okay.
So, and some of those are administrative, but it's on any given day, our daily staffing on the street is 113. So, and then we have the 3 shifts. So quite a few people for a smaller area like Norfolk.
We really thank you. So I'm trying to end these interviews on a positive note. You've all already been very positive, and I appreciate that. But in your the last 3 weeks, is there something that stands out that was a positive outcome that you didn't anticipate as a result of the pandemic and the stay-at-home order?
Oh goodness, yes. So amongst if we want to call it chaos or the concern that everyone really in the world is experiencing, I have seen so many wonderful gestures of kindness, whether it's people just trying to get people in the community just trying to give back to the fire stations or to the hospitals, or whether it's someone donating food, which we've seen countless times, which has been wonderful, or trying to donate PPE, which we've also seen countless times. I think that sometimes we need to do a little bit of a reset and realize what's important. And we are really realizing now what's truly important is the community and our own safety and togetherness. And that's what's probably going to get us through this. More on a professional note, we've reevaluated our procedures multiple times because our administration is working around the clock to continue to keep us updated. And we have gone into this challenge, I guess I'll call it, so well prepared, just because of the information that we've gotten, the decisions that our administration has made, along with advice of other medical professionals. And it's just been really neat to see how hard everybody is working, because we don't often see those behind the scenes efforts. And I think that everyone has seen it all the way out to our citizens of Norfolk, which has been fantastic.
Well, I appreciate you spending the time with me to share what's going on at Norfolk Fire and Rescue. And again, thank you so much for what you do and for what all your team does. Stay safe, be well. And for everybody who's watching this, stay home, save lives, and have a happy holiday weekend. Take care. Bye, Stephanie.
Thank you. Thanks, Andrea. Bye-bye.
Bye-bye.